Hello everyone and welcome to the case 28 of this case discussion series, and today we'll be discussing a case of renal tumor. Here the diagnosis is clear. The discussion part is what is important today. So here we have a 51-year-old male who came for a routine ultrasound checkup, and I saw exophytic renal mass rising from the lower pole of the left kidney and advised a CECT in renal mass protocol to be done. And this is the CECT image. These are the contrast images, axial section. We have to look at the lower pole of the left kidney. Here we can see an exophytic mass lesion which is heterogeneously enhancing in the lower pole. There is no involvement of the collecting system as such. This is the lesion. The renal vessels were normal contrast filling. The lesion was away from the collecting system. Well defined exophytic lesion with some areas of necrosis within. And this is the report that I had given. The well-defined, spherical, predominantly exophytic, heterogeneously enhancing soft tissue density mass lesion of size approx 3.5 into 3.4 into 4.2 centimeter. The size is very important here because in renal nephrometry score, the diameter is one of the criteria to score it. Average attenuation was 34 HU, and it was arising from the lower pole of the left kidney. The lesion did not exhibit any internal fat or calcifications, ruling out angiomyolipoma. The lesion did not extend into or involve the left renal calyces or the collecting system. Left renal artery and vein showed normal contrast filling with no filling defects. The reniform contour of the kidney was preserved, and the left features were suggestive of a left renal neoplasm, exophytic neoplasm with renal nephrometry score of 5. I'll come to what renal nephrometry score is and all its components in the later part of the slides. Both the ureters were in normal caliber and the adrenals were also normal. So this is a very beautiful flow chart as to approach to any renal mass on CT scan. If there is no enhancement, it's a cystic lesion, which is benign. Macroscopic fat is present, the diagnosis is clear, it is angiomyolipoma. When there is enhancement with no fat within the lesion, as was in our case, we have to think of renal cell carcinoma or other such renal tumors. If the enhancement is equivocal, 10 to 20 HU, then it is a low enhancing lesion or pseudo enhancement. We have to consider MRI. If there is mild enhancement, which is seen in hypovascular tumor like papillary renal cell carcinoma, differentials include oncocytoma and minimal fat AML. If there is vivid enhancement, it is most likely a clear cell renal cell carcinoma. DDs again include oncocytoma and minimal fat AML. So this patient, in this case, it showed significant enhancement with some areas of necrosis. So we'll think of renal tumors in this particular case. So another important descriptor of a renal tumor is whether it is ball shaped or whether it is bean shaped. Ball shaped, it is distorting the renal contour, which is seen in renal cell carcinoma, oncocytoma. Bean shaped is when it is very infiltrative within the renal parenchyma. Examples include transitional cell carcinoma and lymphoma. So coming to the renal nephrometry score, which I had given in my report, it can be remembered by the simple mnemonic RENAL. R being the radius, that is the maximum diameter in centimeters. The more the diameter, the more points are allotted. Exophytic or endophytic, E is exophytic or endophytic. More endophytic the tumor, more the points. N is the nearness of the tumor to the collecting system or the sinus. The nearer it is, that is, the lesser the distance between the tumor edge and the collecting system is, the more points it is allotted. Anterior or posterior, it is not given any points here. And L is the location relative to the polar lines. If the lesion is entirely above or below the lower polar lines, these are the polar lines, then it is given lesser points. If it is crossing the polar lines or going across the polar line, it is given more points. That means it is more infiltrative. In any exophytic tumor of the kidney, a very important sign to be looked for is angular interface sign. What exactly is angular interface sign? It is used to characterize any exophytic mass in which the exophytic renal mass has an angular interface with the renal parenchyma. This is the angular interface. It has high sensitivity and specificity. The angular interface sign is a strong predictor to identify the lesions of either cysts, benign tumors, or angiomyolipoma. This angular interface, if it is present, it is likely a benign tumor. And it rarely occurs in malignant lesions like renal cell carcinoma, which usually has a round contour or rounded interface with the renal parenchyma. So this is another case of a 51-year-old male who came with hematuria since the past 1 month, and this is the CCT scan done for this patient. These are the axial sections where we can see that this heterogeneously enhancing soft tissue density mass with multiple areas of necrosis and some fat stranding is seen. These are the coronal images where again we can see this mass, lobulated mass with areas of necrosis. Some neovascularization is seen. This is a SAT section. It's a large mass. This is the report I had given, that lobulated heterogeneously enhancing partially exophytic soft tissue density mass arising from the upper pole with multiple areas of necrosis and few areas of internal calcifications was appreciated on plain images. It extended to involve the right Gerota's fascia. The vein and the artery showed normal contrast filling with no filling defects, hence ruling out any bland or tumor thrombus. There was mild perinephrine fat stranding and multiple tortuous vessels around the kidney supplying the mass lesion, likely because of neovascularization. There were few enlarged mesenteric nodes seen in the vicinity of the mass, and there was no evident involvement of the bowel loops or the adrenal gland. Features were suggestive of right neoplasm, renal neoplasm with renal nephrometry score of 10. So here the lesion has high complexity.